Since 2012, what we have noticed is a huge increase in the number of people that are dying unintentionally.
It's a crapshoot. You go to a dealer, you buy a substance, you're hoping is this certain thing, but it's been mixed improperly, or it's completely a different thing entirely.
Sometimes, though, it is that, for example, the medical examiner's office comes with a picture and asks if we know who this person is because they've been found somewhere. In the olden days, the work that we did was really focused on the positive and really focused on trying to, help people be as safe and healthy as possible. Now we're trying to help people stay alive.
First time she ever decided to take a pill, and that pill, which they thought was MDMA, was fentanyl.
Some of the programs that Streetworks runs includes our normal needle exchange work that we do, and it's never just exchanging a needle, it is trying to connect with people, build trust.
Make sure you put your used ones in here.
There is, of course, our overdose prevention program.
You, the number for a van, which you can call anytime. These are memorial cards from funerals that I've attended over the past while. It's kind of a little bit unsettling and nerve-wracking. I don't think there are too many other jobs where you come to work and you have to worry about, attending funerals that month. It's actually been really hard. It's been really hard. Little cousin, first time, 16 years old, gone.
In terms of the impact that fentanyl has had, now I've been around for over 2 decades. We used to have mostly prescription-based opioid use here in Edmonton. In 2012, in April, that drastically changed when OxyContin was taken off the market. And within a very short amount of time, we saw heroin and fentanyl coming into town in numbers that were unbelievable.
We see people here that we know and they have overdoses, and then we go and help them. We give them naloxone, call EMS, and then the next day they come back and they thank us for giving them that chance to really have another thought.
There are some days when you just we're encouraged to take mental health days for ourselves. It's really, I would say, affected people on a much deeper level because you don't really know who you're not going to see next.
Here you get to know people and they get into your heart. When they get into your heart, then when they die, it is incredibly difficult. Sorry. It's also hard because a lot of the people that we're working with are people that nobody else cares about. What happens right now is that people will come into the needle exchange program and get the needles that they need, but then we have to tell them to leave if they're going to use. If we can get people to stay, have them inject, have them go to the monitoring room and stay, so then suddenly they're not in withdrawal anymore, that is going to open up a whole world now of different ways that we can support people and help people. We have been given an exemption to have 3 small service sites within the city. So basically evenings and night times will be at the George Spady. During the daytime, during the week, it will be one here and one at Macaulay.
Our overdose team and supervised injection sites, I feel like we're going to be pretty close partners with them. We want to open as many doors as possible.
I think the only way that we can stop this is to make sure that people have pharmaceutical grade substances to use. When I talk to people about the notion of harm reduction or of decriminalization, I guess for me the strongest argument is, so do you think it's working now? Because right now we are living in a time of prohibition. We have been since 1971 when the war on drugs was called. I would say things are getting exponentially worse out there, and that really it's time for us to be courageous and to try something different.